Hi, my name is Dr. Emil Tocci. I'm a holistic doctor in Oceanside here, and we have a really busy family practice. And what we've had lately is a lot of people coming in themselves and talking about their families. And some of the things that they're talking about is that they actually are experiencing fatigue, like a mid-afternoon fatigue. Maybe this is you. There are times in the day where you hit a low. You don't feel like you have that energy. They're also talking about brain fog. They're thinking their clarity isn't there. It's not what it used to be. It's just harder for them to stay sharp. It's like we're an 8-cylinder engine. We're 8 cylinders and we're running on like a 4 or a 6. So this may be you. Maybe you're not running on all cylinders. This could be you. Maybe you're having challenges with blood sugar. Maybe you're already taking a medication. Maybe you're on thyroid medication. Maybe some of you are taking testosterone. We had a patient tell us that they're taking testosterone, and their family, some family members are. We have a lot of people coming in that are on insulin, all different types of medications. This might be you. So I wanted to go into some information about what is causing this, because you really want to get to the cause, because if we find out what's causing this, then we can help you to actually overcome these types of challenges. Okay, so in order to get well, you really need to heal at the cellular level. So to get well, you need to heal your cells, okay? So I want to draw a picture of a cell and just show you what can be happening and what could be affecting you and your family. So if we just draw a picture of a cell right here, okay, and I do this a lot during workshops and stuff. Now, around the cell is actually, there's a fatty phospholipid bilayer around every one of your cells, okay? And now you have this membrane around the cell. Now there are 3 main things that can affect your cells and cause cellular inflammation, okay? So the three main things that can be affecting you, the first is glucose, sugars. Maybe you have too much sugar in your diet, okay? So glucose is the first thing, okay? The second thing are bad fats, trans fats, but also vegetable oils, okay? They can actually embed into the membrane, okay, and cause inflammation. And then the third thing is toxins. And there's really 3 main toxins that are affecting us, which I don't want to go into detail in this video. We're going to make another video for that. But the 3 main toxins are mercury, lead, and glyphosate. Okay, those are the 3 main toxins that can be affecting you. And really these toxins, what they do is they build up along the cell, okay? And what they do is they cause inflammation around your cell. So they cause inflammation, which inflames your cells. Now people, when we talk about inflammation, a lot of people know, they'll say things like, yes, inflammation is the underlying cause of all health challenges, which is really true. But it's this inflammation that we're talking about. You may have felt inflammation like in your knee or your shoulder. Yes, we've all had inflammation before. What I'm talking about is cellular inflammation now, okay? So it's the inflammation around the cell. Now, inside the cell, you have another thing called the mitochondria, okay? The mitochondria in your cells is what they produce ATP, which gives us energy. These toxins, okay, they can actually build up along the wall of the mitochondria also and prevent ATP from getting out. The toxins and the inflammation, it can cause inflammation around the cell walls of your mitochondria, but the inflammation around your cell walls can prevent the proper nutrients from coming in, and it can prevent toxins from leaving your cells, so your cells aren't functioning properly, okay? Now, here's another major thing. On your cells are actually receptors. So along all of our cells are receptors. So think about it like this. You have these receptors, okay? And then these receptors are what hormones are going to attach to. So say, for example, we're talking about thyroid, which the active thyroid hormone is actually T3. So you make T4 in your thyroid, and you also make some T3, but you also make T4, and it gets converted to T3. And I don't want to get too technical here, but T4 gets converted to usable thyroid hormone, which is T3. So if someone's taking something like Synthroid, I even have another patient that's taking a bioidentical hormone, they told me, just realize that they're going to give you this. Now here's the issue. Toxins can actually block the receptors so that the hormone does not attach to the receptor as efficiently as they should. And what will happen is you may start to take some hormones, right? Hormone replacement therapy, like Synthroid, for example, and you start to feel better, but then you plateau. Why? Because it's still not able to do its job as effective as it could. And what happens is this is an accumulation of stress over time. This can even affect things like insulin, which you know that insulin is a hormone that's produced in your pancreas that actually what it does is it enables sugar to go into your cells so you can become insulin resistant, which can affect everything from, you being able to utilize sugar, which is actually going to help you to generate energy, but can also affect your blood sugar, which can lead to diabetes and can lead to just a ton of problems, okay? Another one that can be affected, so we have thyroid hormone, we have insulin, we have another one called leptin. Leptin is one that has to do with weight loss. Okay, that's a big one when it comes to weight loss. So these are just some examples of what could be going on. Now, I don't want to go too detailed and get too technical, but I want you to realize that if you do not decrease cellular inflammation and if you do not detox your cell, you will never get to the cause of the problem. You won't solve the problem, okay? And what we're finding is an accumulation, especially of toxins that we were talking about, also with the food that we're eating. But the 3 toxins that I just mentioned before are accumulating in all of our bodies. I want you to think about something. Think about throughout your life when these toxins started accumulating, and now, actually right now, I want you to think about some places in your life and your lifestyle that can actually cause this accumulation of toxins. So just me personally, I know that I was fully vaccinated. I was born in 1974. And back then, actually, the vaccine schedule was this much. Now the vaccine schedule is this much. So there's toxins in the vaccines. There's mercury, there's aluminum, stuff like that, okay? I also took an antibiotic about 15 years ago. I had to take an antibiotic. I took Accutane. About 20 years ago, I took Accutane. That's a nasty drug. I took that for 3 months. I'm just giving you some examples of some of the medications that I've taken. If you're taking any medications now, if you've taken anything in the past, I also have mercury fillings. I'm just giving you some examples of where these toxins can be coming from. Also, they spray all the food with glyphosate. So if you're not eating 100% organic, your food is being sprayed with glyphosate, which is the main component in Roundup, which is really toxic, okay? So these are just some places that these toxins can be building up in your body, and when they build up, they're going to attach to the cell wall, all right, along with the sugar that you're eating, and along with the bad fats that you're eating, like the trans fats, the partially hydrogenated oils, and also the fat from the vegetable oils, okay, that they're telling us to cook with now. There was an article, it's going pretty viral now, talking about how coconut oil is bad, but you should use vegetable oil. That's horrible advice, okay? So these are just some examples of what could be happening, which can be causing your fatigue. Maybe you don't feel like you have that get-go like you used to. Maybe you don't feel like you had that energy like you used to. You feel like you're an 8-cylinder engine, but you're only functioning on 4, maybe 6. And I've been there also, so I've done things to actually detox. We actually have answers to these problems, okay? We have specialized programs that we run in our office where we can help you to get your focus back. We can help you to get that clarity back, that energy back. We can get you running on all cylinders so that you can enjoy life like you used to, right? Maybe you're having weight challenges. Maybe you're having thyroid issues. Whatever it may be, I can tell you this, that if you do not detox at the cellular level and decrease cellular inflammation, right, and actually help with your mitochondria to remove the inflammation from the mitochondria cell wall, also from the wall of the mitochondria, you will not generate ATP, you will not make the energy like you need to. So if you have more questions about this, or if you want to talk deeper about it, please contact us. We're going to have a link where you can actually click. Give us your email address, reach out to us. We'll contact you. If you want more information, we'll be happy to give it to you. We'll speak soon, okay?